Bending your knees while inverted is very different from training a tuck handstand. Superficially, they may look similar, but one is just learning to be lazy with no mechanical benefit, while the other forces you to refine every weakness within your handstand.
And even if you can't be trusted to reliably tie your own shoelaces, you can still probably figure out which is the most beneficial.
Within the tuck handstand, there are two distinct variations I like to use for their unique contributions.
You ask the average person to bring their hands overhead, their ribcage, T-spine and shoulders all move as one fixed unit.
Training the tuck handstand is the first real lesson in forcing dissociation between these actions, a lesson that pays dividends the further you take hand balancing. As you tuck, the center of mass gets pulled more anteriorly, requiring additional shoulder flexion to keep the center of mass aligned. With this additional flexion comes more scapular elevation, and because of the nature of the shape, a greater connection to scap upward rotation, which demands more engagement from the serratus anterior and lower traps. The real challenge is doing this without allowing compensations by extending the spine and flaring the ribs, which robs you of the benefits. This variation shifts focus to maintaining scap elevation while bleeding in protraction. A common mistake is confusing this with simply closing the shoulder angle, leading to a collapsed position with no mechanical benefits. Instead, this pulls more from the serratus anterior and pecs, teaching active scapular control. Arms will no longer be purely vertical, but if you stay connected through the rib cage, you'll begin to see how this feeds directly into proving pressing mechanics, strength, and coordination. Both variations can be practiced in less severe positions and using the wall. Just make sure you're always managing where your center of mass sits, or it might not directly transfer to your balance work.